A very good evening to you, ladies and gentlemen. I'm excited to welcome you to the 130th Bar Association of Sri Lanka webinar organized by the BASL Seminars Committee on the topic COVID-19 Prevention and Management, Steps for the Future. This is the 18th webinar of the 4th webinar series on professional, personal, and career development, hosted by the Bar Association of Sri Lanka and conducted on the Zoom platform. And for those of you who are unable to register on Zoom, hopefully you're joining us on our YouTube live stream on the BASL YouTube channel. Before we start, I would like to thank the Seminars Committee of the BASL, the Chairman of the Seminars Committee and the Secretary of the BASL, Mr. Rajiv Amarasuriya, Convener of the Seminars Committee and the Assistant Secretary of the BASL, Mr. Pasindu Silva, and the co-conveners, Mr. Pandula Vanniyarachchi, Mr. Ushan Uberatna, Ms. Anne Devananda, and Ms. Nikini Mapitigama. I would also like to take this opportunity to thank the President of the BASL, Mr. Salia Pires, President's Council, and the other members of the Management Committee of the Bar Association for all their support and guidance. As I've already mentioned, today's topic is on COVID-19 prevention and management, steps of the future. And it gives me great pleasure to introduce Professor Suranjit Senaviratna, our esteemed guest speaker for this evening. Professor Senaviratna is currently serving at the Institute of Immunity and Transplantation of the Royal Free Hospital at the University College London and Health Services Laboratories, London, UK. He completed his Bachelor of Medicine, Bachelor of Surgery degree at the Faculty of Medicine, University of Colombo, with a first-class honors, 8 distinctions, and 10 gold medals, and was placed first in his year. He completed his MD in International Medicine and trained in clinical immunology and allergy at the John Radcliffe Hospital in Oxford. He completed his Doctor of Philosophy in Molecular Medicine at the Wetherall Institute of Molecular Medicine, University of Oxford, as a Commonwealth Scholar. So far, he has authored 262 journal publications and has an H index of 42. He has published in esteemed journals such as Nature, Science, Nature Medicine, Blood, American Journal of Medical Genetics, American Journal of Human Genetics, Journal of Experimental Medicine, and Journal of Allergy and Clinical Immunology. Professor Senaviratna is an international expert in immunodeficiency, autoimmune, allergic, or mast cell disorders, and immunogenetics. He's the director of the Center for Mast Cell Disorders and the president of the Sri Lanka UK Immunology Foundation, an organization that contributes to the immunology and allergy education in Sri Lanka. The moderator for this evening is Mr. Yajesh Tennakon. Mr. Tennakon holds a master's degree in international commercial law, arbitration, and intellectual property. He started his career as a prosecutor in the Attorney General's Department and is currently practicing in the unofficial bar. He's the Director Legal of the Yacht Company Private Limited, Independent Television Network, and he is a member of the Criminal Justice Reform Committee of the Ministry of Justice. He also acts as a legal consultant for several commercial entities such as Verbag Limited, Marvel Marketing, Sarvodaya Fusion, Economic Development Advisory Council, and the National Development Institute. He is also a visiting lecturer at the University of Kelaniya and the University of Sri Jayawardenepura. With that, let me remind members joining this session by Zoom to send in their questions to the Q&A chat box to reach the moderator. I will now hand over the proceedings to the moderator. Over to you, Mr. Tennakon.
Thank you very much, Tanuja. Well, first of all, as you said and mentioned, we should thank the entire committee for organizing this event. And going to the topic, Professor Senaviratna, what really is the current situation in relation to the pandemic, and are we actually safe as a community?
Okay. So I think I will touch these when I do the talk, and then we can discuss the different questions that come out from what we have learned so far. So what I would initially, shall I get on with the sort of a small presentation, and then get into focus with regards to the specific questions of how we should deal with things, and what are the preventive measures that can be taken in the future. So just a minute, I'll share the slide. Okay. So let me first start off by thanking the Bar Association and Secretary Rajiv and this president, and also Anne and Yajit and Tarindu for organizing this and giving me a sort of some time to discuss some aspects with regards to COVID-19 prevention and management. So I will try to give you a quick overview in the next 20 minutes or so, and then take questions which will come out from that, which will sort of follow on from that overview, so that we can discuss the different aspects that are very, very topical at the present moment. Now, all of us have been with COVID for close to 2 years. Close to 250 million people have been affected around the world, 5 million deaths. So it has been a big problem across the world. All of you would know it. At one time, Sri Lanka, the number of cases were low, but then there was, since April, there has been an uptick in cases. And we have to remember that economies have to open, people have to get around. So we should take the usual sort of sensible preventive measures when things take place in the future and look into the future. The UK, US, and India has been really affected with around 141,000 deaths in the UK. And what has been noticed is some of the cycles that have occurred about 3 to 4 months ahead in the UK. And some of the messages that come out from that can be looked into, and the good points taken from that in making policy decisions within any other country. Same with the US and same with other parts of the world. So if we look at the SARS-CoV-2 virus, the virus is called SARS-CoV-2, and the disease is called COVID. It's an mRNA virus, and around that you have the spike protein and the envelope protein. Just focus on the spike protein. That spike protein is what binds to the cell, and then the virus enters the cell, it multiplies within the cell, and then it spreads from cell to cell and from person to person. So that binding is important. And what we're trying to do is trying to prevent the binding, and using vaccination or the person not seeing the virus in the first place by having sort of, by ensuring that the people have adequate social distancing, wearing masks, etc. So we'll come back to the spike protein. I just want to illustrate that figure, what the spike protein is. Now, if you look at the number of vaccines that have been approved, abandoned, and are being studied, you will immediately see that around 8 to 10 vaccines have been approved so far. But a number of vaccines have been abandoned. That is to say that not every vaccine that they started development became successful. So there were some vaccines that were abandoned, while we have quite a few good vaccines around. A number of other vaccines are in development, as shown in the next slide, where you can see that this was the bottom schematic, showed the picture 2 months ago, and you can see that number of other vaccines have come into development, but 3 more vaccines have been abandoned, and the number of vaccines approved have remained around the same. If you look at the position around the world, you can see the number of people who have received the first dose. This is an old slide from May 2021. And you can see certain countries were right on top. Israel, US, UK, etc. were right on top. Very high vaccination, very high percentages receiving the first dose. Then you come on to the next period, end of August. And again, you can see India, which was low previously, has now increased. and the level of vaccination in India has improved and increased. Then you come to the current situation, and this is very, very important. Look at that slide, look, October 31st, 30th. Nigeria, Bangladesh, Pakistan is low, is at the bottom of that slide. And the important thing is the countries right on the top can't be complacent. They cannot say we have saved all our people, so we are fine, etc. Because people from Nigeria, people from Pakistan, people from Bangladesh will travel across countries. And if they're not vaccinated and you don't have sufficient social distancing measures, etc., which should go hand in hand with the vaccination, we could run into problems, especially if a new variant comes across. So those are very important things to monitor what happens around the world, because we do not deal in isolation. We are not dealing with just one part of the world. We are dealing with the whole world. And unless we protect everyone, you find that no one is really protected. So what I quickly run through is some aspects of the immune system, because you would want to know how do you look after your immune system, how do you prevent you getting bad attacks of COVID, etc. in the future. Talk to you about variants, because that's very important. It's quite topical. People are talking about that. And then just touch a bit on the vaccines also. So what can we do for the future? Because we know Sri Lanka has gone ahead with the vaccination and the next steps should be taken. So I'll focus on the next steps in vaccination. So if you look at the immune system, you have viruses, bacteria, and fungi trying to attack our body. Like any country having the army, the air force, and the navy, you have the defense system of our body. That's the immune system. You have different parts. You have the innate immune system, you have the adaptive immune system. Those terms don't mean too much. You have antibodies, you have white cells, and those get together to be able to keep the person healthy. And we have to look after our immune system. We cannot neglect our immune system. So sometimes the immune system doesn't function properly, and that is called immunodeficiency. Immunodeficient. Sometimes it misbehaves itself and it starts attacking our own body cells. It's called autoimmunity. Sometimes you get allergies, and sometimes the person develops cancers. So we should look at both aspects. It can be functioning normally. You have to look after it. It can be it is not functioning properly, or it can be functioning in an abnormal way. And I told him autoimmunity, cancer, and allergy. Cytokines are chemicals which the immune system uses to talk to each other. So like us using language, English, Sinhala, etc. to talk to each other, the immune cells and immune system uses cytokine. And the cytokines have to be at a specific level. It should be regulated level. If it's too high, it's not good. If it's too low, it's not good. And in COVID, you get a situation where the cytokines are really high, and that is not good. There is hypercytokine. So if I just stop a little and tell you what I mean by looking after your immune system. Many of the people listening to this are busy professionals who are multitasking, doing a lot of things within a 24-hour period, etc. But your immune system does need basic things to look after it. You don't need all the gold dust covered medicines to look after the immune system. You should have adequate amounts of sleep, adequate proper meal times, if possible, as far as possible. Sufficient amount of liquids to be taken, not stressing yourself out till you just cannot cope up with it. And not smoking, any alcohol in real moderation, not overdoing it, because those are things which will look after your immune system. It's like a car. If you get a car, there's no purpose, if the engine is not working properly, there's no purpose in putting a coat of paint or changing the seats, etc. But that car won't function properly. And we have to ensure that we look after our immune system if we want the immune system to function properly and for us to be healthy. So that is an important take-home message that I want to put in quite early. So with COVID, the disease that happens with SARS-CoV-2 virus, you get lots of immune changes, and that is what doctors look at. Some cells increase, some others decrease, some chemicals increased, etc. And we know that quite a lot at the moment. We have studied that and been able to identify what are the changes that occur. Now, why is that done? Not because of people not having anything to do, but the reason being that if we know what is changed, we can correct it if a person gets COVID. And the important thing is, if you get COVID, not everyone gets severe symptoms. Some have very mild symptoms or asymptomatic. So you should continue your regular medications. If you're taking inhalers, please continue that. Paracetamol can be taken, but not excessively. Avoid non-steroidal anti-inflammatory drugs like Voltarol, etc. Avoid that, definitely. Aspirin, if you're already taking it, please take it. That is low-dose aspirin, unless the doctor tells you to stop, but otherwise take it. Do not start aspirin as a new medication if that has not been prescribed, because some people think they can get clotting and they start aspirin. No, that is not good. Do not start antibiotics and steroid if you're at home and you have mild symptoms. That's really a problem. I know in Sri Lanka that does occur. Please don't start antibiotics and steroids, because those are very important drugs in the correct context. If you go into hospital, the doctor will decide, okay, you need steroids, and steroids have been a major drug in the correct context once a person gets into hospital. Vitamin D is important. Take a vitamin D. Other vitamins can be taken. If you take a lot of other vitamins, they will just, if it's too much, it will go in the urine. But vitamin D is important. Don't take too much, but take sufficient amount and increase the amount of fluid that are taken. So these are some basic steps. You look after your immune system, prevent it getting with social distancing and vaccination. And then if you get it, these are the steps that you should follow to be able to protect you and prevent you getting into the severe end of the spectrum. So immune system, there are antibodies, IgG, A and M. We won't discuss this too much, but there are 3 types of important antibodies. There are CD4 cells, CD8 cells. So those are the things that happen when you get COVID-19. Now, what do we do with vaccines? We're trying to get these molecules in your body before you get the infection. Because anyone getting the infection takes about 7-8 days for this immune system to get activated and working properly. So that might be too late, because some people could die if they get COVID and they progress very rapidly. So you want to give them the vaccine to prevent, so that when the virus comes into your body, it will be quickly neutralized and it will prevent the person getting severe infections. And that is an important thing, why vaccination is important, even if a person has had COVID in the past. Age is important. The older you are, the worse
Professor, if you allow me to interrupt you right now, you just mentioned a period after getting the disease. What is the exact period that you should get the vaccination if you get the disease?
So it is 1 month. It's taken at about 1 month after getting COVID-19 and recovering. It's about 1 month that you should wait before taking the injection. That is the period that is recommended. So age is a very, very appropriate question, an important question, Ajay. Age is an important thing, because the older you are, if you have diabetes, hypertension, obesity, renal disease, and liver disease, the chances of you getting severe COVID is high. So if you're over 50, please look after it. Don't take things for granted, because your risk of severe COVID is so much higher. Doesn't mean that younger people won't get severe COVID. It is just that you're increasing your risk. So take extra precaution with regards to social distancing, vaccination, etc. That is so important, because the vaccines don't work as good in the older person. And therefore, you should take it early and give your body a chance of being able to protect against that infection. So that is some basic aspects of the immune system and the response to COVID-19. And I told you, look after your immune system. Some basic things are important before going for the wonderful drugs that are around there. Basic things, sleep adequate amount. When you were 15 years of age, you could have slept 3 hours a day because you were studying, etc. But you cannot do that when you're 40, 50, 60. You do have to have the rest. You don't want to be working yourself to the level that you just cannot have any downtime. If you're walking, if you're going to a place and it's one flight of stairs and you're okay, climb that. Don't always jump into the lift and try to go up there. So it's a basic thing to be able to look after your immune system overall. Next, we come on to some of the variants. Now, you know that this has been in the news for many months, since about October last year. And we have 4 major variants that have been in the world: alpha, beta, gamma, delta. There are many articles written on this, and those are the major ones. Alpha started in the UK, beta was South Africa, gamma was in South America, and then delta started in India, and now it's the predominant variant that is found around the world. So delta is the main variant. And at the moment, we have this thing called delta plus, and we could discuss this at a later stage. It has been written about. So delta and delta plus. So what is the effect of the variants? The virus will mutate. Virus definitely mutates, and there are about so many mutations that have occurred in the virus. But to be important, there are 5 things that we look at. Does it spread faster? Does it cause more severe disease? Does it affect our testing? Does it affect our treatment? And does it affect the vaccine? So to be classified as an important variant of concern, it has to affect these factors. That is the important. So we have 4 variants of concern: alpha, beta, gamma, delta. It affects these 5 things, and that is why it's a variant of concern. The WHO has brought it in as alpha, beta, gamma, delta, because previously it was UK variant, South African variant, Indian variant. That was not really great for the countries, etc. So they have brought it and said variant of concern and variant of interest. Variant of interest means it's just below the level where it has still not caused all the effects, and therefore it's a variant that is of interest that people are following. And this is the variant, these are the variants of interest that have been described so far. So that were described initially. And if we look at the Delta variant, you can see that previously people were talking about double variant, double mutant, etc. That is because it had 2 important changes. Doesn't mean that it had only 2 changes, but these were the 2 important changes. That was why people used to refer it as the double mutant. And we have written quite a lot of articles about this, about the Delta variant, the new scourge of the sort of current global scourge, etc. And now Delta plus variant has come into the picture. Now, when WHO initially classified the variants, you can see alpha, beta, gamma, delta, and the variants of interest. You can see the variants of interest that are given there using the Greek letters, letters of the alphabet. But you can't see lambda and mu. So things change. Why I put this slide is to tell you that things do change. And subsequently, lambda and mu also came to the focus. Again, lots of people have written about mu and lambda. This is a problem in certain parts of the world, and these are what we have to watch out for. So we have to monitor the variants, and if new variants come, assess them and see whether they are clinically important. And that's what people are doing with regards to the Delta plus variant. But the Delta variant is the most established one. In the UK, we are having some cases of Delta plus variant that are circulating around. So that was a quick run through the immune system and COVID, SARS-CoV-2 variants. I just asked about when should you get a sort of vaccine after infection. It's 1 month. And now we come quickly to the COVID-19 vaccines and other general measures. Lots have been known about the vaccines. It's against a spike protein, as I've shown you on the surface. Most of the vaccines so far are predominantly against the spike protein, and these are the common vaccines that have been approved so far. The best vaccines are Pfizer and Moderna. No doubt about that. They are the best vaccines around, mRNA vaccines. Second lot of vaccines are AstraZeneca, J&J, and the Sputnik vaccine. They are viral vector vaccines. I won't go into detail, so if anybody are. And then you have the killed vaccine, that are the Sinopharm and the Sinovac. Now, when there was a pandemic, you don't keep on choosing what vaccine you should get. Any approved vaccine should be got. And that is correct what Sri Lanka did. Sinopharm was that, it gave the people. You don't look on and wait, because some immunity is better than no immunity. And that is an important thing to remember. You don't look on. When you get the booster, when you go for the third dose of the vaccine, then you go for the best vaccine. So you always get some immunity and you develop it on it using the best vaccine. And that is why the booster is now with Pfizer and Moderna, Pfizer predominantly. So even if you get to AstraZeneca, your booster, you go on and get the Pfizer. So those are the important considerations, because people are asking that question, can I combine vaccines, etc.? Yes, you can combine vaccine. And the reason is, when there's a pandemic, you just get any vaccine that is approved by a big regulatory body, and then you try to consolidate using the best vaccine around. Now, Yajish and I have been discussing before that, just early on, about infection, disease, and transmission. Very important. What were the vaccines designed to do? It was designed to prevent people dying, getting into hospital, and getting ICU care. That is disease, severe disease. We did not want people to have severe disease. So it has done what that, because even in the UK now, the number of cases are high, but the number of deaths, hospitalizations, and ICU care is very much low compared to the number of cases. However, despite vaccination, people can get infected, and that must be remembered. So you can have asymptomatic infection despite having the vaccine, but it's like a cold or cough, and you don't get into hospital. Now, the important concept of that is those people can spread the disease. They are vaccinated, they have mild infection, they can spread the disease to people who are not vaccinated. And that's an important thing to remember. So especially when non-vaccinated people are in contact with vaccinated people, be aware of that, because you are at very much higher risk, because already the person who is vaccinated can be having a mild infection at time, and they can be transmitted the disease. That's a very important concept to remember. So knowing this, initially many months ago, the UK established 9 groups to vaccinate, and they followed this very, very carefully. The older the person, over 85, if they had diseases like cancer, immune deficiency, or autoimmunity, or other disease that increased their risk, they were vaccinated very, very early. And this is the group that is getting the booster dose vaccination at the present moment, or what we call the third dose or booster dose. Using the original vaccination, we found the number of cases reducing. However, it is not only vaccination. So the important thing in Sri Lanka, we have vaccinated at a good rate, but people cannot be complacent. It's social distancing, wearing masks, hand washing, proper social measures, going hand in hand with vaccination, which would keep rates low, because people are going to come into the country, children are going to go into schools, and people are going to mix around. But you have to remember that just because you're vaccinated doesn't mean that that is sufficient. Both social distancing measures must go together. One dose of vaccination is not sufficient. One dose would only provide about 30% protection. So don't have a false sense of sort of protection by taking one dose of vaccine. You do need to have 2 doses to get the appropriate amount of protection, especially with the Delta variant that is around the world. Next thing, which I mentioned, is both the vaccines, even when if you get a mild infection after getting 2 doses, you can transmit it. You can transmit it to the people who are not have been vaccinated. So unvaccinated people are close to 30 times more likely to be hospitalized than any vaccinated. That's the important message to take home. And especially that group has to have so much more social distancing provisions in place, because otherwise they are at such a high risk of getting COVID. Now, what about how long does the vaccine response last? That's a very important question. Do I need a third dose? Do I need a fourth dose? Do I need a fifth dose? So the study so far has shown that after about 5 to 6 months, antibody levels start waning off. And this was a study showing the Pfizer's midterm efficacy study. There was another study from Zoe COVID study, again, showing that after about 5 to 6 months, the vaccine responses tended to wane off. So therefore, now governments across the world are going for an additional dose in people who are healthy. It's generally at 5 to 6 months. In people who have immune system problems or have cancer, it is very much earlier that they're going, and that is after the second dose. So that is the reason for going for a third dose, because of the waning of immunity. And again, we have written quite a bit about this, the third dose COVID vaccine for people with immune deficiency. And at the present moment in the UK, it's 6 months if you're healthy, 5 to 6 months. They're trying to bring it down to 5 months with Delta Plus, etc., come into focus. Cancer patients, please protect those group of patients, because their response to vaccination is not as robust as a healthy person. So they need to get the third dose quite soon, and they should be protected with additional measures. Mask, hand washing, social distance is extremely important in addition to vaccination in any person who has a cancer, who has been treated for cancer. Extremely important. Other measures are present. In cancer patient, I won't go into detail about monoclonal antibodies, etc., but I won't go into detail. And we know about the new pill that is coming out and being trialed at the moment, Molnupiravir, but again, we could discuss at a later stage. So I told you, look after your immune deficient patient, look after your cancer patient, look after people who have a high risk of getting severe COVID, because that is the group that can turn again and can be affected. What about children? Another important group. I think that's a very topical topic around the world. This was a bit of an old article when we discussed the pros and cons of vaccinating children. And at that stage, this is about 3 months ago, so things changed quite a lot. At that stage, a certain group of children were to be vaccinated. And this was the article on that aspect. What is the position of vaccinating children in the UK? If the child is 16 or 17, if it's 18, it's taken as an adult, getting 2 doses. If the child is 16 or 17, they are given 2 doses of the Pfizer vaccine. We do not, in the certain countries, if you're younger than a certain age, we don't give the AstraZeneca. So in the UK, they're getting the Pfizer or the Moderna vaccine. 12 to 15 years, if they have a medical problem, important increased risk of infection, or they're immunocompromised, or they're living with somebody who is taking steroids and other immunosuppressive drugs, then you give 2 doses, 8 weeks apart. If there is no history, if they are healthy children between the age of 12 and 15, they are given 1 Pfizer dose. At the moment, that is the recommendation, 1 Pfizer dose, and that recommendation could be changed as things go forward, because there has to be a balance between any potential effects, adverse effect, against the benefit that can be reached. Parental consent, I think these are important points which comes into the legal framework with doctors. Gillick competence is an important concept in this area. That is the doctor, because sometimes the child can want the vaccine between 12 and 15, and the parent can say, no, we don't want to take the vaccine. So the doctors or the healthcare personnel is expected to check if the child fully understands what is involved, and the present position is a parent cannot overrule a decision of a GILIC competent child. That is the present situation we follow with all vaccines, including the COVID vaccine in the children between 12 and 15. Now, what happens about a young age group? 11, 10, 9, number of people have asked me the question. So very recently, Pfizer produced this study in 2,268 children. They found between 5 and 11 years, they found 91% effective in preventing symptomatic COVID. So what is the effect of that? Very recently, the FDA, the main body in the regulatory body in the US, gave emergency approval for this vaccine between the age of 5 and 11. It's still not been rolled out, but emergency approval has been given. And the dose is 1/3 the adult or the teenage dose. That's important to remember, 1/3. So therefore, different bottles will come. The bottles are orange capped as opposed to the adult dose. That's very important when the process starts in a different country to ensure this. And 2 doses were the one that was approved. China has already started vaccinating children, and several other countries have also vaccinated even younger children here, but most countries are waiting for the US to start the process. Why have they started vaccinating? What's the reason? People will wonder, why are they vaccinating 5 to 11? This is the evidence provided by the FDA. There's been 8,300 hospitalizations since the start of the pandemic between 5 and 11 years. 1/3 ended in ICU care, and no parent would want their child to go into ICU, and about 100 deaths in children between the age of 5 to 11 years. Most of the problems occurred in children who were obese or who had asthma and other comorbidities or other problems. A lot of sort of Black and Hispanic children were affected in this group, and that is why it's important for South Asia to consider. And there was so much of school that was missed because schools were closed, and approximately 1 million children were affected by this. So because of this, the US is considering vaccinating, offering the vaccine to 5 to 11. It has still been only approved by the FDA, but it has not been rolled out as yet. So that is about children. I told you about the UK. Still, the UK has not started 5 to 11, but it is 12 and above healthy children, 1 dose of vaccine. COVID vaccine mandates, again, important aspect when it comes to legal matters, etc. Workplace vaccination mandates are in place in the US. In the UK, it's a different picture. They were waiting for Pfizer full approval because with emergency approval, these mandates were very difficult to bring into place. So Pfizer received the full approval, and therefore they have brought in workplace vaccine mandates. If you take 2 companies, 2 different companies, Goldman Sachs, anyone entering their building has to show that they have received 2 vaccines. McDonald's, all US-based office workers have to have 2 vaccines, otherwise they would not be allowed to work. New York hospital system said there is no way they have to be vaccinated, and they found that it was 92% compliance. But they thought the compliance will be low because of labor shortages, etc. But they found 92% of compliance, and that may be because leaving a job in the US can be it's very costly and difficult to get back on the system. So it's a different system exactly. In the UK, the picture is a little bit different. UK is leaning towards mandates for NHS workers because over 100,000 NHS workers are still not vaccinated. And the problem is the patients are bringing sort of things forward saying that they're not safe, and it is not safe for an NHS person who is not vaccinated to be treating them. So this has been on the card, and greater than 5 million on the waiting list for non-emergency care, and therefore you cannot mess up with the health sector at this stage, especially with winter coming up. So that is some aspects about vaccine mandates, about children, about immune deficiency, which I spoke to you. Some of the current updates on COVID-19 vaccine was again in this article, and you could refer to this article, or I can send you a copy. But what I've done in this quick talk, and then we can go on to certain questions, I just give you an outline of where does vaccination fit in the whole process. It's a severe disease, it can potentially be severe disease. You need social distancing, very important, hand washing, mask. You need vaccines going hand in hand. Sri Lanka has really gone well with the vaccinations, giving the first dose and second dose, which we should build up on that. I told you about the immune system. Look after your immune system properly. Don't expect wonders if you don't look after the immune system. Look after, if you get COVID, don't just swallow antibiotics and steroids if it's not indicated. Told you about the variants, the Delta variant, the Delta plus variant that we're looking at recently, and the newer variants coming in. And then lastly, I told you about the importance of vaccines, the different vaccines, get any vaccines initially, and then consolidate. Spoke to you about cancer patients, immune deficient patients, children, and finally about vaccine mandates, etc. Thanks a lot.
Thank you very much, Professor. Well, I believe you have gone in depth to most of the grounds we spoke before the seminar, before we started the webinar. And just one aspect which you mentioned, what is adequate sleep? How many hours is adequate sleep?
Okay, very good question. Let me just quickly get out of this, stop the slide share so that I can talk directly onto that. Right, excellent. Yeah. So very, very appropriate question. Now, Rajesh, firstly, we have to realize that we are not computers. We are human beings which are variable. Some of us are tall, some of us are short, some of us are very intelligent, some of us are moderate levels of intelligence. So we are variable, right? So we differ in, some are bald, some have more hair. So that sort of thing. So when it comes to health too, you can give a value as say 6 to 8 hours. Okay, you can give it like that. But the important thing is to have at least between 6 and 8 hours, especially as you go older. Now, when you were a teenager, you may have been studying for exam, you may have been able to sleep for about 4 hours, etc. But as you go older, then you come into the 20s, and all of us know when we were junior doctors, junior lawyers, the amount of work we did. And I mean, without an intern, you'd work 24 hours, 365 days till you finish the internship, right? So, but then after that, our body has to relax. We have to go into what we call Rem sleep, the deep sleep, where our body repairs, relaxes, our immune system has to recover. And if you sleep for about 3-4 hours per day, why? Because my colleague is doing that, my friend is doing that, then you're going to build up, you're not going to recover, and you're going to build up more and more damage. So you can be taking all gold-coated tablets, you can be taking all the vitamins you want, you can be taking all the supplements you have to have, you can be going and seeing the best, as you'd say, BASL has like sort of medical people, the specialists. But if you're not looked after yourself, there's no way that your immune system can recover. And if your immune system is not working properly, the heart, the lung, the kidney, the bones, joints, etc., are not going to function. So I would say about 6 to 8 hours. You have to link it up with your job, but at least 6 to 8 hours is needed.
Thank you, Professor. Well, another aspect, I believe, like you actually mentioned that excessive drinking and smoking is harmful. But then again, a perception in society is that by the time if a person is smoking, the nicotine kind of kills the possibility of getting the virus. So that is something which I have heard from people. But is there any reality to it, or what is the reality?
Right. Very, very good question. So let us take that in two parts. Now, smoking, what do you have? You have tobacco plus a lot of other toxic material that is found in the cigarette that is smoked. it goes to the lung and it causes inflammation in the lung. So already your lung capacity is going to drop. If you're a heavy smoker, your lung capacity and lung function is going to drop. So therefore, it's like trying to tie a person's leg or try to and tell the person to do a 100 meters race. They are not going to do as well as person who has no impediment. So therefore, when you have your lungs already not working at optimal levels, not the lung, the other thing, the heart, the kidney, the liver, etc., you find that if you get an infection, a virus or a bacteria or a fungus that needs all guns blazing, you want everything to come in together. If you're fighting an enemy, you don't want 2 or 3 components to be, bystanders sitting and having a chat, etc. You want everyone to work together and get rid of. So therefore, smoking is detrimental. We know that. Alcohol, there has been this discussion over a long period of time. I mean, over drinking, binge drinking, taking too many units during a week is what is dangerous. Avoid that, because that will again bring down your immune defenses, bring down your liver function, etc. 1 drink per 3 days or small amounts won't be detrimental in that level, but heavy or binge drinking is the one that is important. Now, looking at that aspect, we have to remember that I think a lot of that confusion occurred when Mr. Trump went and spoke about bleach being used to kill COVID, etc. People took it very literally, and they started doing things. So they thought, smoking, therefore they can. It would be that the components will kill the COVID, but that was all a lot of sort of pseudoscience that was going on. But one important message to be given, I think that's a very important. Some people will be smoking, some people will be taking big amounts of alcohol or binge drinking. Those people should not be told, don't get the vaccine. Those people should be told to take extra precaution from other aspects, because if you don't give them the vaccine, they are just the group that can get severe COVID. And if they get severe COVID, they're going to get into hospital, they're going to die, they're going to have a bad effect on the health system. And that's not good, because it will affect other people who have cancers, heart disease, who cannot get the proper care. So at one time, there was a wrong message going that if you are smoking or drinking, don't take the vaccine. No, actually, those people were told to get the vaccine early, not because they want to reward those people and say, oh, excellent, but that is because if you don't treat them, they can get severe COVID and mess up a lot of things across the board. So that is an important thing to remember. Controlling smoking and alcohol should go at all time, amounts of alcohol, but it should not be linked to a message like COVID. They should be vaccinated, but also should take the other measure, because overall not smoking and reducing the amount of alcohol is beneficial from a general health perspective and an immune perspective.
Thank you, Professor. Well, another aspect, you just mentioned about the variants, Delta, Alpha, Beta, Gamma, and all of it. Now, when it comes to other diseases like chickenpox or measles or even smallpox, which was there some time back, there haven't been much variants. And then again, the vaccines have been quite effective. And after getting a vaccine or after getting one infection, the chances of getting another infection is quite remote. But what is the difference as against COVID and also influenza? Why you have a chance of getting an infection after vaccination and also after getting an infection again?
Good, very, very good question. So now, what I mentioned before was it's an mRNA virus. So there are certain viruses that will change or keep on. Viruses, what do? They enter the body cell, they multiply and spread from cell to cell and from person to person. When they multiply and spread, they can make mistakes. And in the case of SARS-CoV-2, which is an mRNA virus, there are mistakes can be made, and there are some steps to try and correct the mistake. But if the mistakes are made in the virus, the genetics of the virus, then you find that new variants will come, and they can be established if they have a survival advantage or transmission advantage, or if they they can avoid the vaccine. One thing with the vaccines, we know that this is one condition that the vaccines, because there was a lot of money and a lot of effort involved, within 11 months, we got some effective vaccines. Better vaccines will come as we go on. Definitely better vaccine will come. Certain viruses like the flu virus mutates very much more rapidly. That is why we had to give a vaccine every year to people to prevent flu. HIV mutates at a very much higher rate. We still don't have a vaccine for HIV. And that was what people were thinking. Would we be in a situation where people are trying to get a vaccine, and we can't get a vaccine for SARS-CoV-2, that is against COVID. And if that situation occurred, that would have been really bad. Now, what the vaccines were originally designed, remember, it's against a spike protein. What they were designed was to reduce deaths, ICU care, hospitalization, and severe COVID. It has done what it has to be done. So the next level of vaccines or the development of vaccines, they'll be targeting to reduce infection too. So still, though you're vaccinated, you have two vaccines, you've got two vaccines, you can have a mild infection. You won't get into hospital, you won't get into ICU, the chances are lower, it's reduced, but you can get a mild infection. And the problem we're having with that is that the non-vaccinated, when they come in contact with the vaccinated, because they are not going around holding a board saying I'm not vaccinated, etc., they are going to be exposed to that virus, and therefore they can get quite severe disease and end up in hospital. And that is what we're seeing in the UK. So to answer the question, certain viruses are more variable. Either we don't have a vaccine like HIV, or we have to give the vaccine every year. SARS-CoV-2, we know that a third dose would be needed, and that is being given at different times in different countries. Would we need a booster every year to keep the population, living with the COVID? That may be something that will have to come with the results it will come in. But in addition to the vaccine, one cannot let your guard down and say, I've got two vaccines, so therefore I'm not going to wear a mask. I'm going to go to any nightclub and be with about 400 people without any proper ventilation, etc. I'm not going to wash my hands. I'm not going to have adequate social. That cannot be done. And that is an important thing in Sri Lanka too, because different countries have looked at that, Israel, etc. They found that they opened up too soon. And that in itself is not how thing. It should be a stage process. One thing with the UK, they used the vaccine. Lots of the high-risk population got the vaccines by February, March. After that, the country, it was a staged opening. You have to open up. I mean, now the UK has opened up to a great extent. But the important thing was a stage opening. Still, with winter coming, we have to be careful, right? And that is why people are rushing to get the third dose. But it should be a balance between vaccination, social distancing measures, etc., and good policy decisions should be put on the table, and then a decision made on that.
Thank you, Professor. Well, one concern I believe as lawyers, everyone has is like in courts, generally it is crowded. Courts are generally crowded, but then again, how to really avoid getting infected? That is one of the main aspects which is in concern in relation to lawyers. One thing is, as you mentioned, wearing the mask and the face covers and sanitizers. But then again, would it actually provide full protection to us?
So I think it's a combination of a few factors, Rajesh. I think firstly, look after your immune system to the optimal, in general, to be healthy. Don't think COVID is the only problem that people can get with regards to the immune system. There are so many other conditions. So general measures, try to be healthy. No one can live till they are 200, 300 years. Everyone would have their immune system getting into we should try to prolong and look after that. That's number one. Number two is get your vaccines. I mean, that's an important thing because that will have some immunity is better than no immunity. That is a message that is important. But just because you have the vaccine, I mean, now there are certain situations where you cannot say it, like a lawyer being in court, or, I mean, if it is possible to have certain situations where you have it to telemedicine, etc., not telemedicine, using sort of the internet-based system, but that may not be practical. So you have to work within your context. I mean, like GPs initially, they did it using telemedicine. Consultants did it telemedicine, but now you have to see patients, and you have to get back into sort of routine work in life. In which case, I think not ensuring that if somebody doesn't follow some regulation, you should not be hesitant to tell that person, you're not following that. I mean, it differs across different boundaries, right? It across different countries. But in the UK, if somebody is not wearing a mask where they're not supposed to, people would tell them, right? People would point that out, because not only that they are putting themselves at risk, but they're putting other people at risk. However,
I believe that is one aspect which we all find difficult. Like, if someone is speaking to you without a mask, to tell them directly, please put on your mask. That I believe we should, even if we have a consultation with a client, to make sure that the client is being told, put on your mask and be safe.
I think it's because it's safety from both angles. Rajesh, that's the important thing. It's not only that you're trying to safeguard you, but that person, the other person too, right? I mean, they may be in a hurry, etc. They may just don't want to. But I think it is, if people have their own levels of control and look at the other person also, get their vaccine, get protection, etc., that would be very, very much more. I mean, it's like smoking, right? Now in smoking, people will say, okay, we are smoking, it's damage to us. So but then the thing is that passive smoking, and that is why there were mandates saying you cannot smoke inside inside a hotel, you can't smoke. So I think it has to be looking to the rights of both the person who is affected and the person who is doing the thing, right? I mean, that those are important. Telling the other person if they're not following the correct protocols as it is needed.
Thank you, Professor. Then again, we have to remind there is a chat where if you have any questions, you can definitely post it within the chat here, and the professor will be ready to answer such. And I believe we have covered most of the aspects we discussed. And but then again, one main aspect which I believe is the risk on diabetic patients, and also people who are expecting babies, like pregnant women.
Very
what
important.
is
Yeah. So diabetes, you're at high risk, and we know that in Sri Lanka, in South Asia, because of our insulin resistance, the chance of a person having problems with sugar is higher in the subcontinent. That is, even if they move across to the west, they are in a bit of a problem in that aspect. Obesity comes in, abdominal obesity, etc. Those are aspects to always remember when it comes to anyone in the subcontinent. So obesity, diabetes, hypertension, heart disease, and if you have some renal impairment or liver impairment, those are overall bad factors with regards to COVID. So the first thing is try your best not to get that factor. If the person already has the factor, get your vaccines, get as much protection, because especially fatty liver disease, etc., we have noted that the risk is very much high in somebody with fatty liver disease getting COVID. And secondly, the important thing is take additional measures in addition to the vaccinations, that is the social distancing, etc. So diabetes, extreme diet, control your diabetes, that's the important thing. Control the primary disease, because if diabetes is not controlled, then that is another problem. It just goes out of Because if you do get an infection, then it's more difficult if your diabetes is also not under control. When it comes to pregnant ladies, now the trials, unfortunately, over the years and over decades, have excluded pregnant ladies and children when they did the initial trials. Now, children, people might say, yes, we cannot just give up any product without seeing how it acts in adults. But then there's a lot of discussion, should pregnant ladies be included very early in trials? Because that's a very important group of person when it comes to protection. So the current protocol that is being followed is, if you get COVID during pregnancy, the outcomes are quite bad for a lot of people. You do not know which pregnant person getting COVID will do bad as opposed to another pregnant. So the sort of overarching thing is to receive the vaccine, 2 doses of the vaccine after 12 weeks, and to receive preferably the Pfizer vaccine, but in different countries, if the Pfizer is not available, other vaccines have been gone for. In the UK, we don't give the AstraZeneca because of the age range, but it is to get the vaccine. Number one, it protects the lady from getting complications, the female or the woman. Secondly, it protects premature birth, which is not a thing that we would like to have, especially certain parts of the world or any part of the world. And the next one is, if it's given at sufficient time, the antibodies can cross the placenta and protect the baby also, because at the moment, the baby does not have any other protection other than something that can be developed from the mother, because you don't vaccinate the child when they're born.
So one question which comes up is that, say, if you're pregnant, how long, within what period of time are you able to take the vaccine?
The recommendation at the moment is that by the time you detect that you're pregnant and tests are done, etc., and then the vaccine is recommended, it's 12 weeks. That's at the end of the first trimester that you're recommended to get the vaccine. That leads up to another important question, because quite a handful of young persons are not taking the vaccine, thinking that they become infertile, or they may not be able to become pregnant. Now, the problem is, we always have to take into consideration, getting a vaccine as opposed to the disease, right? That is the important thing, because if you get COVID, if a youngster gets COVID, the complication that can occur, including long COVID, which we have not touched on, there's this condition called long COVID, which is a condition which fatigue, tiredness, lethargy, headaches, brain fog, etc., that can occur in people who recover from COVID. So long COVID, if a person gets long COVID, the chances of you not being able to, that is without the vaccine, if you get COVID and get long COVID, the chance of you not being able to have babies and be infertile is so much more higher. So therefore, none of the vaccines have been shown to affect fertility. You're refusing something that has not been shown to affect fertility, and having the risk of getting COVID, getting long COVID, and ending up in a sick state and not being able to have children. So that's the double whammy that is there, and that has to be considered by people when they just refuse vaccines.
So, Yes, in a conclusion, that means no vaccines actually have caused harmful effects to any human up to now as on clinical
fertility, on the fertility.
And on the fertility. Has any vaccine caused any major complications in health, any with regard to fertility or any other aspect?
And you're talking about COVID vaccines, right? COVID vaccine. Yeah. So COVID vaccines, several people have mild side effects, like any other vaccine. Mild side effects, tenderness, a bit of swelling, a bit of fever, some headache, etc. after the vaccine. That is called reactogenicity. Small groups of patients, know about the clotting that occurred with the AstraZeneca vaccine and the risk, the allergies that occurred with the Pfizer vaccine initially. But now we have better data. We always have to put that into context with the risk if you don't get the vaccine and if you get the disease. So it is like, right, you're crossing the road. There is a lorry coming at a speed towards you, but you're more concerned about some object falling out from a plane that is going above you and knocking you down while the lorry is coming to you. So, there's a bigger risk by getting COVID of clotting. And that is why most bodies said, most regulatory bodies said, if the risk of COVID is very high, go ahead and get the AstraZeneca vaccine. And that is an important. So there was the clotting issue. In addition, very few patients have developed Guillain-Barré syndrome. It's a neurological condition, small numbers of people. And then you had myocarditis, which again, we didn't speak about, but which people are talking about in children, males, young children after the Pfizer vaccine. Again, the value that is given at the moment is 4 per million vaccine doses, 1 in 250,000. The children recover. That is so far no long-term effects of the dose, but getting COVID has so much a downside. So always your comparator has to be what happens if they get COVID. So those are the adverse effects that have been sort of described. There are rarer adverse effects that are there, but of the common ones, none of them have been life-threatening when you look at the common adverse effects.
Finally, going through the chat, there seems to be no questions, but then again, there are a few questions which were referred to me privately. And one such is, do we actually have hope to have a normal life again? And do we have hope that we can live a life without COVID?
Life without COVID for some months, years may not be something we would be, I think, foreseeing going at the present time, unless something like a tablet, the molnupiravir also comes in, some other sort of other preparation like nasal vaccination, etc. comes in. Can we get back into some sort of normality? Yes, I think I've been looking at what is happening in different countries, even in the UK. I mean, I've been during the pandemic living in the UK. You can see that there were safeguards, but it was sort of thought out and balanced safeguards being put in place and released. Not perfect. People learn, and that's the most important thing of any country looking at other countries and learning from other countries. That's an important message that is there, because if something has happened, good things have happened in the US, in the UK, in Germany, other countries must look at it. If certain good things have happened in Sri Lanka, India, Pakistan, in Indonesia, I think there's so much of good take-home message that other countries in the West can take. So have people come back to sort of, I would say we have come back to midway. At one time, we couldn't step out of the house. We had to be in our house. We couldn't go out, etc. We were not allowed to, just get out. As soon as the cases went down, just step out and then run riot. It was a stage process with people wearing masks, etc. Now it has been relaxed. We have to bring it back again if the number of cases increase and there's important damage on the health system. But I think that has to be monitored by a core group of people who are monitoring the world, monitoring Sri Lanka position, and then bring in restrictions and remove them at the correct pace, rather than being too slow. Too slow is also not good, because that would have a detrimental effect on other sectors of the economy and etc. And people won't then follow regulation. And too fast is also not not appropriate. And that should be a country level decision rather than, but you can learn quite a lot from other countries and take home messages from other countries that have done it in the past.
Thank you very much, Professor. Well, finally concluding our discussion, I believe the message we should take is that we, regardless of we having the vaccinations or regardless of us being previously infected, we still have a chance of getting infected again. And right now we see a lot of nightclubs open and fully crowds are packed in shopping malls and so forth. So your health and your safety is in your hands. So I believe that's the message which is forwarded by Professor Senaviratna, and I'm thankful to Professor Senaviratna for his time and for the amazing lecture given, and also to the organizing committee. And Tanuja, over to you. And Professor, please, if you have anything to mention.
Thank you very much for giving me the opportunity. I think it was really good questions, really good sort of aspects, and especially with regards to Sri Lanka. I mean, at one time when you spoke, because we were blessed that the number of cases were low. I can remember when I used to give any webinar around January, February, the thought was, COVID won't affect, etc. Then it changed in April. And at that stage, vaccination was just because at that time to get vaccines were just a bit slower. But now we vaccinated people followed regulations, people did things, but then now is the time not to lose momentum. Get it. We have gained a lot from vaccination. We've gained a lot from people waiting at home, etc. But now, open it up in a sensible way so that things will move forward, and we won't have to have any more sort of closures, etc.
Thank you very much, Professor. And Tanuja, over to you.
Thank you. Thanks.
Thank you, Professor. Thank you very much, Mr. Tenakon. On behalf of the Bar Association of Sri Lanka and the Seminars Committee, I would like to thank Professor Suranjit Senaviratna and Mr. Yajesh Tenakon for this very informative and valuable session on COVID-19 prevention and management. I would also like to thank all of you who joined us through Zoom and YouTube. Thank you, everyone. Do join us next Sunday at 7 p.m. for the next webinar in this series on professional, personal, and career development. Stay safe and good night.